See, he actually ate for me, and I thought, and then he didn't want to eat, and I thought he's gonna want to eat the second she's up. Yes. Hi.
Hello.
Take your attendance right when at the front. Sure, go to the end.
We got a hot mic.
Say it one more time. Unmute yourself. I may have just muted you.
No, I was just saying we got a hot mic out there.
You've got a what?
Someone had a hot mic, but I believe that they muted themselves now.
A hot. All right. Do I want to know what that is? What's a hot mic?
It means that your mic is unmuted and you don't know it and you're talking for everyone to hear.
Oh, yeah. Okay. Yep. All right. I was like, what's a hot mic? I know what that is. Okay.
Yeah. Not quite in the same realm of drop it like it's hot.
Okay.
Slightly different.
That works. I can go with that.
I think I might have been one of the ones that didn't have their mic muted. So I'm sorry if you heard my kids screaming and singing in the background.
We're good. We're good. You know, and my mom just heard you from the other room and she said, well, you have a dog that snores. So we can deal with the screaming kid.
Hi, Professor.
Hi, how are you?
I'm good. How are you?
I'm hanging in there.
I have a question for you.
Go.
So you teach 122, right? AMP2?
I do, but I don't know what I'm teaching next semester. Is that what you were going to ask?
But I wasn't gonna ask that, but I mean, I would like to have you as my next professor as well. But I was wondering if you knew if the lab had that fumigator, like if you're actually gonna be like in a chemistry lab next semester for AMP, or
You know
how does that
what?
work?
If I have a choice, I'm going to keep teaching online.
Okay.
I don't know. And you know what? And you guys are not what campus are you? Is it Lancaster or Harrisburg?
I'm out of Lancaster.
Okay. I don't even know where Lancaster is right now. In all honesty.
It's about 30 minutes south of Harrisburg.
All right.
It's like if you go to York and you go east, we're about like 20 minutes.
Okay. Is it like near Hershey Park?
No, it's not near Hershey Park. It's so like we're 30 minutes and 30 minutes from Hershey. So we go to south. We're kind of close to the Maryland border.
Oh.
I think it's like 25 minutes, I think. But if someone wants to correct me, they can.
Okay.
No, I think you're correct.
Okay.
It's
No,
still-
right now, if I have a choice, and we'll see, you know, every semester gets easier for me if I just keep doing it. This semester is a little bit more chaotic than last semester, I think, because I'm teaching new classes that I'm having to kind of reinvent, and that's making my life a little nuts. But right now, dean of the college who decides what classes I teach, he knows that I would prefer to teach online for HAC.
Okay.
And so I'm teaching solely online, but that may change. We'll just see what happens.
But I was just wondering in general, like
Yeah.
for an A&P class with a lab, like is it generally held in like a chemistry lab, or is it?
I don't think it would be held in a chemistry lab. It might be. If I knew what HAC did, I don't even know what they really do in their online lab, in their face-to-face A&P labs, because I've always taught online for HAC.
Oh, okay.
I can say that normally that's not taught in a room with a lot of fumigation, because I've taught A&P labs. I teach A&P labs for Stevenson, and I've taught A&P labs for Carroll. And at both places, they weren't in high fumigation labs.
Okay. I was just wondering because I have that hearing disability, and I took a chemistry class and I was in a chemistry lab, and I could barely hear the professor because of that stupid fumigator. Well, not stupid.
When
but
that happens, ask them to move you to the front of the room.
I did sit in the front of the room, and it still
It
wouldn't.
was still that bad.
Yeah, I eventually had to drop the class because I was worried about the personal safety and also class safety because I couldn't hear the instructions and I
Did you
couldn't
talk,
understand them.
Lauren, did you talk with the professor?
I did, and he's like, "Well, there's not much I can do." And I talked with Access Services, and they were like, "Oh no, they can't really do anything. They
Really?
couldn't really do anything either." So.
Okay, well, I will tell you what, I mean, one of the classes, when in a classroom like that, what I end up doing normally is I end up teaching in the middle of the room. Is I stand in the, with the students surrounding me, I stand in the middle of the room. The other thing that I think I'm gonna end up having to do is I'm gonna buy a mini mic. I need to, it gets so crazy for me during the semester that if I'm going to do it, I need to do it before the semester starts because I have to learn how to use it. But most professors, they're not that expensive. But what'd you say, Mom? Yeah, most microphones, they're not that expensive, mini mics. I don't think you're going to be in a high fumigation room. But what you could do is before you apply into a class, before you actually register for it, if you can, contact the professor who teaches the class and ask them.
Okay, I'll do that then. See what they say. Thank you.
You're welcome. Yeah, I mean, the A&P room, the only A&P room, the only campus I have been to for HAC is the York campus. I have a nephew coming here this summer. I told you about did I tell you? No, probably not. My nephew decided to slice his finger open this last week, and he's 12 years old, and he may be coming this summer. And if he comes, he wants me to take him to the colleges that I work at. And so I will probably be going to the Gettysburg campus for the first time. But I've only been to the York one right now, and their A&P room is not loudly ventilated. Does that help?
Yeah, it definitely helps.
I don't think they are loudly ventilated. I know sometimes it doesn't even matter. Even if you're not going to use that ventilation, the room is still ventilated. even if it's not necessary. But the room, at least on the York campus, is not highly ventilated. But I would ask the professor. Because I know that I taught in a room at Stevenson that was really highly ventilated last semester. And yes, students struggle to hear, and they're even normal hearing students. Other questions?
Professor Gessel,
Yeah.
I emailed you about that exam one, and you said you were going to talk about it. When you
Exam one. Oh, yes, thank you. Yes. So I realized I said that the exam would cover 1 through 3. And then I realized that there's a typo in my syllabus as I was looking at it. And it says, what it says is that after we cover chapter 7 approximately, we have an exam that is going to cover chapters 1 through 3. The second exam covers chapters 12 through 14. Do you see the problem? There isn't an exam that's covering chapter 7 until the cumulative final. And that's not a good idea. Would you prefer? So the way it should work is that either exam 1 needs to cover chapters 1 through 3 and 7, or exam 2 needs to cover chapter 7, 12 through 14, and 12 through 14. What would you prefer? I will tell you what I would prefer. I would prefer to include chapter 7 in this first exam. And the reason is because even though this is only going to be 3 chapters, they're long chapters. What would you prefer that I do?
Now, these will be timed, right? Will we get extra time?
It'll be the same timing that you have with the quizzes, approximately 80 seconds per question or answer.
And because we're getting that extra chapter, that won't go up any?
It'll go up because the number of questions will, well, you know what? The number of questions will probably not go up. What I do is I go in and I give the, bear with me really quickly here. I have to remember what I did last semester, and I don't remember. So give me one moment, because what I'm going to do is I'll show you what it was for them last semester. It covered chapter 7 last semester.
I'm Otis.
Back on right here. There's an L on that boy's forehead. No, it's just me. That's the person now.
C, X, N, Q.
Okay. Clicking on this. It wouldn't be more questions. If I gave you more questions, I would give you more time.
Okay.
No, I'm not gonna give you more questions and then only give you the same amount of time.
How many questions?
Well, let me tell you how many the last one had, and then I'll have an idea. because I don't remember. Realize that 6 months ago for me was an eternity. I don't think that far back. Just give me 1 second here. Exam 2. No, exam 1. So it was 82 questions out of a pool of 176. Give me 1 second here. I'm going to look at the questions and I'll be able to tell you what chapters it covered. I think it covered chapter 7. I'm not letting you read them. I don't want you to see the questions, but I'm gonna look and just see what it says. Maybe it only covered through chapter 3. Actually, let's bear with me. I'm sorry. Give me 1 second here. I thought it covered chapter 7, and now I'm wondering if it didn't, because I don't see any questions there from chapter 7. And I will tell you that I'm learning as I go. As I keep teaching, I'm improving every semester, believe it or not. You can feel that for my first 121 students. But I'm learning as I go. And I like what I did. What happened last semester was actually a fairly good semester. And I think, because trying to get, and when I say fairly good semester, based on the success of my students, how well did they do in the course on average? It was a good semester. So with that in mind, because this first exam, it doesn't look like it covered, and I'm going to go to exam 2. It doesn't look like it covered chapter 7, exam 1. And so I want to look and see what exam 2 was. So it was also 82 questions. So approximately 82 questions. Okay, so what I did last semester, and I'm going to go to the next one because the exam 2 last semester covered chapter 7. I want to see one more thing. Exam 3. What it looks like is that, bear with me here, I'm coming back to our syllabus. And I may have revised it because we got significantly behind, not as behind. We're not behind in compare this semester as we were last semester. And so I know I pushed questions back and I pushed exams back. Let me look here. So I think that exam 3 covered 14, 15, 16, and 11. Exam 2 covered chapter 7, chapter 12, and chapter 13. Would you prefer I do the same thing now?
Yes.
I would prefer to do that too. And the reason is like, I'm going with past history. I don't remember, bear with me here. And I'm going to stop sharing for a second. And I'll tell you how many students failed the course. I'll tell you how many got A's too. Give me a second here. It's a little long. It's a full screen. Okay. Okay, now I realize why I didn't include chapter 7 was because that was probably the idea all along, was to include chapter 7 in exam 2. But I taught 3 121 courses last semester. And of the students, I only taught one. So I taught 3 lectures, 121, and I taught 1 lab. The number of students who got A's, actually, let's say A's and B's. 1, 2, 3, 4, 5, 6, 7, 8, 9. A's and B's, 9 out of 24. How many students failed? Give me 1 second, I'm looking. 3 students failed. 1 of them quit showing up. Once you quit doing the work, there's really no way to pass you. And I think you can understand that. Once you quit doing the work, there's no way to pass you. 1 of them I know was involved in some form of cheating. I'm going to go to another core class just a sec, because that was the course that I gave the most work to. So because it was my lecture and lab course like this is. But like I said before, I'm giving you less work than I did students in the past. Okay, this is how many students got A's in this course. And this is another 121. 1, 2, 3, 4, 5, 6, 7, 8. So 8 students, and I don't know how many there are here, but 8 students, that was how many students got A's in the course. And that isn't really, that's not the best study example. I would, and the reason was because their lab instructor was a twit. We won't go into detail with that, but the guy was a jerk. And if I'd realized how bad he was with them, but I only found out after the semester was over, because now I have some of them in 122, how bad he was. And if I'd realized how awful he was with them, I would have been calling my dean on him. But that's another story for another day. Do you still want me to combine? Do you want me to give you one exam over chapters 1 through 3?
Well, Professor Gessel, let me ask you, if you add chapter 7 to it, like when do you think we would have the exam?
Probably in 2 weeks.
So like right before spring break or right after?
You're cutting in and out.
Is it spring break like the 12th to the 18th?
I think it is it the, I thought it was the 18th.
Okay, maybe it is. I don't know.
I think it's the 18th. Because I
saw on a bunch of different places that it was the 14th, the week of the 14th.
it's the week of the 14th. I believe you. I know that at least one of my spring breaks is the week of the 18th. And I can tell you, I just go with what the syllabus tells me. Because all 3 of my schools have it on different weeks. Let me look. It is actually, it's the week of the 18th.
Good to know, thank you.
I'm sorry, March 14th through the 18th. Bear, you know what? I know, bear with me. I'm going to look on the academic calendar.
I just looked on the academic calendar. It's March 12th to the 18th.
I thought we had class on the 14th. We don't have class on the 14th.
Midterm break 12th through 18th. Midterm grades posted March 14th.
Okay. I'm sure you're right. You guys, let me give you, let's do an exam over chapters 1 through 3. Like it said in the syllabus. And then we'll do an exam over 7 through, we go to 12 and 13. The chapters 15 and 16 are really, really short. Chapter 11 is longer. So let me give you one next week. And it will be open for a week.
So starting on the 28th, the 7th.
Say it one more time.
So the exam would be through March 7th, correct?
That sounds about right. Let me look.
Monday to Monday.
Yes, because that would be about 2 weeks. And so it would open on the 7th. We will continue to have class that week, but it will open on the 7th and it will close on the 12th. Actually, what I'm going to open it before then, because I want it to be open for a week, but I need it to be on your midterm grades. Let's have it open March 7th. Let's have it open on, we will finish chapter 3 next week. We will finish it. If I can, I'm going to do part of it tonight. I want to finish part of it tonight. We will finish it next week. So it will actually open next week. And it will be open for a week. Let me, sorry, I'm looking at the calendar on my phone. I will have it open the evening of the 28th. So this is next Monday. And it will be open through, let me here. Would you like me to open it for you now?
Yes.
Okay.
I like to try to work ahead as much as possible.
Okay, give me 1 second here. Let me see if I have it set up right. Do me a favor, don't do it during lab tonight. You're gonna make me crazy if you do that. But let's,
We're gonna have just one attempt.
say it again.
Are we going to have just one attempt, or
You'll have 2 attempts. You'll have 2.
okay, for the lecture then, right?
Let me look at what I've got here. So it's the same exam I gave before. And it's the same PowerPoints I gave before. I'm going to stop sharing just for a second here. So it's going to open at 7 p.m. here. And it will close on this, let's see here. It will close on the 7th of March. So you'll have a week and a half. Actually, let's do it a little longer than that. It will close on the 12th. I need it to close on the 12th because I have to get grades in, and grades take longer than you'd ever expect them to do. And you will have 230 minutes to do it. 2 attempts. Let me look. Sorry, bear with me here. I just want to make sure I've got it in here right. I'm sorry, I'm setting it up as we speak. So give me 1 second here. I'm just making sure that I'm setting it up right. Yeah. So it's going to be open tonight. It'll open in half hour, 20 minutes, and it'll be open through March 12th. And you'll have 230 minutes per attempt to take it. And it's going to be posted under the exams. So now, if we go one second, I'm going to share my screen. So if we go to exams, and you tell me if you don't see it on your, somebody try to look it up on their D2L and make sure it's there. But it should be under exams. Do you see it there? Marissa, is it showing up for you?
Yeah, it's on there. Due March 12th at 11:59, starts February 23rd at 7 o'clock.
Right.
Mhm.
Okay. Now, any other questions for right now?
No, thank you.
What?
No, thank you.
Of course. All right, let's jump into tonight's lab. So tonight we actually really start getting into anatomy. We've been hinting at it. We've talked about body and regional parts. That was the first week. Done the integumentary system. We've done tissues. We're going to start looking specifically at the bones. 1 second here.
I'm sorry, while you're doing that, you said under exam, right?
Mm-hmm.
I don't see it.
Yes.
Mine.
Look, you don't see it under exams. Refresh your screen, Zena.
I did that twice, but it didn't show me. I can try it again.
Is it still not there?
No.
Okay,
I can wait until the end of class. I was just wondering if that's where I was supposed to be.
how many, are there other people who can't find it there? We having other issues?
I'm checking now.
This question isn't about the exam, but I went on to the assignments and chapter 7 is due next week, but chapter 3 is due in March. So I was just wondering if that
I
was
will
accurate.
push back chapter 7. I'll push it back.
Okay, thank you.
Are there any other, let me try something with the exam. Let's try one more thing.
It's on mine.
It is? Zena, can you get it?
No, I just tried it and
Alright.
it's empty.
It's on mine too, so.
Bear with me here.
Now, maybe you just have to close out the program and open it.
Yeah, you're right. Maybe let me try that. I'm gonna sign
Well,
out.
I'm gonna do something really quick, see if I can make this. Make it 6:45 and see if it's just not showing up because it's not open yet. Hopefully it won't assign it twice. We'll find out. Oh, but it did. All right.
I'm sorry.
No, all right, go in and see if you, in just a few minutes, go in and see if you can't find it.
Okay, I just tried it. I signed out and went back in, but it's still not there for me.
Okay.
It might show up later.
All right, well, I've set it so it should open in 2 minutes. Actually, 1 minute now. Nope, still 2 minutes. And while I'm right here, give me 1 second because I'm gonna do the smart. No, I'm gonna wait on the smart book, but I will push it back. So lab exercises, and you'll see this PowerPoint is for, we're only doing lab exercises 8 and 9 this week. But this also includes 10 because the 8 and 9, the lab exercise 8 is over osseous tissue and bone, general bone, long bone anatomy. Lab exercise 9 is over the axial skeleton. Lab 10, which is next week, is over the appendicular skeleton. But because they're all very similar and they kind of flow well together, they're all in one PowerPoint here. Does that make sense? And if we go to another list here, this is a list of the bony markings that you need to know. And if you look, there's a lot of them. You don't need to know what their opening's for. So here's a bony marking that says it's an opening for the branch of the pharyngeal artery. You don't need to know that. You just need to know that that's the foramen lacerum and where it is. And I'll show you where it is. For this week, we will cover up to right here, page 6. So we're going to cover that. We're going to cover osseous tissue, long bone anatomy, and then we are going to cover the bony markings and bones of the axial skeleton. So, anatomy of long bones. There are 2 types of bone within each bone. When we're specifically looking at the long bones, we have compact or cortical bone, which is around the outer edge. Well, compact or cortical bone. And it encloses the marrow or the medullary cavity. Marrow cavity or medullary cavity. The spongy or cancellous bone is within the center of the cortical bone. It looks spongy. It's where the name comes from. Cancellous meaning it's holy. So compact bone or cortical bone on the outer edges. And then it encloses the marrow or medullary cavity, which is on the internal, and lining the medullary cavity and found in the ends of the long bones is the spongy or cancellous bone. On the ends of the bones are called the epiphyses. You remember epi meaning on top. So epiphyses are the ends of the bone. And the diaphysis is the middle part of the bone. So the epiphyses are the distal or proximal ends of the bone. What does it mean to be the distal or proximal end of a bone?
Distal would be further away from the connecting joint, and proximal would be closer to the origin of the connecting joint.
You're really, really close. But what do you mean? There's probably joints on both sides. How else could we describe it?
Towards the center of the body, like the main.
You're good. That's great. So I think my mother just gave you a hooray in the background there. So midline, looking at any bone. So for example, looking at your shoulder, and actually I've got a skeleton here. It's not as grand as the ones that they tend to have in classrooms. but I think it's pretty good. So this is my skeleton Bob. It is Bob. My mom, what did you name him? Chester?
Yeah, he can either be Chester or Chester's a good name.
Chester's a good name. I think we'll still call him Bob. Okay. So here we're looking at Bob's long bone, his humerus here. Here's the proximal epiphysis, distal epiphysis, because the midline is right here on the back. Let's do some more. So here's our femur, proximal epiphysis, distal epiphysis. The epiphyseal plate or the growth plate is hyaline cartilage that's located at the metaphysis, which is the connection. The metaphysis is the connection between the epiphysis and the diaphysis. Think of metaphysis as being in the middle. So it's in the middle of the epiphysis and the diaphysis of your long bones. You gotta love all these physises. So epiphyseal plate or growth plate is hyaline cartilage. Remember, you saw this when we were talking about the connective tissues. And when the growth plate seals, when your long bones are done growing, it will become the epiphyseal line. Also, another location on bones that we have hyaline cartilage is on that joint surfaces. Remember, hyaline means glassy or smooth. The hyaline cartilage on the joint surfaces allows for a friction-free or frictionless or minimizing friction between two joining bones. Articular meaning to articulate. So the medullary cavity is a space within the diaphysis containing yellow marrow in adults. Until you're about a year to 2 years old, or it might be younger than that, your long bones contain red bone marrow. As you get older, it becomes yellow bone marrow. No, yeah, it is. Okay. I think it is. She's asking me if our printer's on. So the yellow marrow is, as you grow older, is going to get turned into, the red marrow, as you grow older is going to be converted into yellow marrow. However, if you become anemic and you require more blood supply than what you have, it can slowly convert back to being red marrow. Anemic meaning you need more blood than you have. The endosteum, remember what? Oh, actually, let's introduce a word here. I'm going to introduce a few words here where I keep going. So osteum, anytime you hear the word osteum, it means bone. If you think what it means to ossify, it means to become like bone, become hard, become bone. So osteum means bone. Endosteum remember, endo means inner part, like endocytosis. Endosteum, and it's not two O's. Now it's not going to let me change it. Darn it. All right, there's only one O there. Endosteum, it means inner bone layer or inner bone, but it's specifically an inner bone layer. One other part that my nephew right now, I told you he really got his finger nailed and he had an emergency surgery on it on Tuesday. He cut the tendon in his index finger. And he also, while he was doing this, he nicked the bone. And the outer surface of the bone, the periosteum, has a lot of nerves in it. And right now he's learning all about that because he's in a lot of pain as he tries to recover from his severed finger. And he didn't sever his finger, but he cut it well enough that he nicked the bone and he cut the tendon. So endosteum, meaning the inner part of the bone, inner layer of the bone. Periosteum, meaning the outer bone layer. Think peri meaning around. So periosteum meaning around the outer bone layer. Another question, another one to remember, because we'll see this again. The medulla or medullary. Means inner part or inner area, inner something or other, inner cavity, inner area. So endosteum, that inner layer lining the inner marrow cavity, is a reticular connective tissue. Remember that you had a reticular connective tissue when we were talking about the connective tissues that has cells that dissolve the osseous tissue. Osseous meaning bone. And others, and it also contains cells that are going to deposit the bone. We'll learn as we move into chapter 7, it's a very dynamic tissue in that you're constantly breaking it down and building it up. So the endosteum is this reticular connective tissue lining that lines the inner marrow cavity. And it's got cells in it that both dissolve the osseous tissue and others that deposit it. We also have nutrient foramina that are holes where the blood vessels are going to enter the bone. Bones are really highly vascularized. Periosteum is that tough outer fibrous collagenous layer that is going to line the outer part of the bone. And it's going to have a lot of inner osteogenic bone forming cells. When you osteo, just like osseous means bone, genic meaning producing something. Here. Oh. So osteum means bone. Osteo means bone. And oh, when things end in genic, do you remember, did we talk about what genesis meant? What does it mean?
To build.
To build. So when something ends in genic, just like Genesis, when it ends in genic, that means it's generating, it's building. So when we talk about osteogenic cells, we're talking about cells that are generating bone. Within the cortical compact bone, remember this is on the outer, this is the outer surfaces. We have osteons or Halversian systems. These are the structural units of bone that consist of concentric lamellae. Think of them, they look almost, it looks like the trunk of a tree, cross section through the trunk of a tree. The individual rings are the lamellae. And they encircle a central canal or a Halversian canal. And the canal and the lamellae are connected by what are called caniculi, little tiny canals. That's what caniculi means. It means little pinpoint canals. So I'm going to zoom in really quick. Maybe if we can actually see. Okay. So right here, are my individual rings. You can see them. Here's one, the one outer edge of one ring, the inner edge of the same ring, right? You see it? Maybe? Tell me if you don't see it. I'm going to zoom in just a little bit more. Now. So right here, if you look here, think of this as a tree trunk. Looking at the cross section, and the individual rings are the lamellae or lamella. Lamella meaning singular. The central canal is the center. Each of the lamellae are connected to one another through caniculi. If you look, I'm going to zoom in just a little bit more. If you look right here, do you see the little tiny striations? Those are the caniculi. So looking at this picture right here, here's our central canal. Here's a half section through excuse me, an osteon. So the whole osteon is this whole area right here, which in this case would be this to this. Looking at a cross section through the bone, here's one lamellae. Here's the next lamellae. Here's the next lamellae. And the individual lamellae are connected via these caniculi to the central canal, which contains the blood vessels. The blood vessels are connected to one another so that the blood vessels, meaning the central canals, are connected to one another via what's called the Volkmann canals or the perforating canals. These horizontal canals. Questions? So the blood vessels and the nerves are going to move up through the central canals. So all of these canals, so the central canals that are going to running right through here, and the Volkmann canals or the perforating canals are all lined with endosteum, just like the inner part of the medullary cavity, which is right here.
So in each osteon, will there be the canals in each like central, so each one?
Yep.
Okay.
And remember, we're only looking at cortical bone right now. We're only looking at cortical or compact bone. We're going to learn that when we look at spongy bone, we don't have canals, and we'll talk about why. We don't need them. But within compact bone, within the center of each osteon, which you only have these types of osteons in cortical bone. And within the center every time, yes, there's a central canal. So the blood vessels and the nerves are going to enter through the nutrient foramina, which are going to open into the perforating Volkmann canals that are going to lead into the central canals. I'm going to stop just for a quick moment here. So I'm going to draw an osteon. Here's my central canal. Make it fairly dark. With my kindergarten drawing here. And then so that's my central canal. And I'm going to draw some lamellae around it. Here's one. Here's another one. Here's another one. Here's another one. Okay. Now. So here's my central canal. Here's my lamellae. Now, if you saw on that PowerPoint slide that we just had up, there's little dark spots right here. Do you see them? They're on the edges of the lamellae. You see them? You people that I can actually see. Okay. Those are osteocytes. So right on the edges have these little osteocytes. Osteocytes. And I'm going to change these ones on the outer edge because they don't look exactly like that. Oh, come on. There. Okay. They look more like flatter lines. So here's my osteocytes. Remember what does site mean? What does site mean?
Cell.
Cell. So Justin, I'm glad you're back and I'm glad you're feeling better. Maybe a little better.
Thank you. My camera would be on, but I'm eating soup. My throat is still killing me.
Ouch. Okay. So osteocytes are, if site means cell, what does osteocyte mean?
Bone cell.
Bone cell, right. So within these rings, on the edges of these rings of that are the lamellae, we have osteocytes that reside here. And you remember when we talked about diffusion, how important it was? And that you have to have blood vessels. And the only way for these osteocytes to survive here is if they can get nutrients and eliminate waste. Well, how do they do that if the only blood vessels are right here? They do it by being connected to one another through caniculi. The most innermost osteocytes connect with the central canal. And if this isn't completely clear, we're going to go over it again in chapter 7. A lot of this we're summarizing some of what we're going to go over in chapter 7. But caniculi are going to connect the osteocytes together. The osteocytes are not mobile when they're like this. Bone is constantly being broken down and restructured. But until this bone is broken down, these osteocytes are kind of stuck where they are. And they reside in little, what are called lacunae right here. Reside in lacunae. I don't like the yellow. Let's change that out. Lacunae. And lacunae means, we maybe talked about this when we talked about cartilage. Do you remember talking about lacunae? Samantha does. Meaning cavities. So the osteocytes on the edges of the lamellae are residing within lacunae. These inner cavities. And so they're connected to one another. The osteocytes in their lacunae are connected to one another via the caniculi, which allows them to receive nutrients from the central canal and eliminate waste. Questions about how this is set up? So the innermost osteocytes, the ones at the very beginning, Zena, I don't know how you do what you do, but I'm sure it's worth it. So
Definitely.
So most innermost osteocytes are maintaining a two-way flow to the more outermost osteocytes. So here's another picture just showing the lamellae, the central canal, the osteocytes in the lacunae, and the caniculi. The compact bone also contains more things besides just osteons, because osteons are constantly being broken down and reformed. And the result is that we have a mishmash of older osteocytes and newer formed, older osteons and newer osteons. The older ones are not really intact osteons anymore. They're interstitial lamellae. And so we have interstitial lamellae. Think interstitial mean like interstitial fluid being in between the cells. So in this case, these interstitial lamellae are between the different osteons. Around the outer edge of the bone, right next to where the periosteum would be, we have circumferential lamellae. It helps me to remember circumferential if I think this is the circumference of a circle. and the circumferential lamellae are on the most outer edge. The most inner boundary is also circumferential lamellae. So in between the newly formed osteons, the newest formed osteons, you have the remnants of older osteons that have been broken down to make way for newer osteons. And the remnants of those older osteons are the interstitial lamellae. Around the outer edges and the inner edge are the circumferential lamellae, because they're the ones that are almost making a full circle, one around the inner part of the bone, one around the outer part of the bone. Questions? So spongy or cancellous bone contains trabeculae. Zena, do you remember trabeculae from talking about the heart in 122? Probably not, maybe. Within, trabeculae means little bars. And on the inner lining of the heart, we have what's called trabeculae carnae, which means little bars of flesh. Here in the bones, we have trabeculae that are just called bars. So trabeculae means bars. If you cut through one of these trabeculae, you would get what looks like a mini osteon, minus the fact that it doesn't have a central canal. Why doesn't it have a central canal?
Because it's not a compact bone, maybe?
It's not compact bone, but you know, still bones still need blood. They're still growing, they're still dynamic, they're still actively metabolizing. They still need blood. So why don't we have a central canal here?
Because
The spaces in the trabeculae, they provide what the central canal would provide for the compact bone.
Listen to you smart people. Yes, so that's correct. So the fact that the spaces in between the bone, it contains blood vessels and bone marrow, which is going to supply. And so rather than having things from the most innermost osteocytes moving out to the most outermost osteocytes, it's moving in reverse here, because the blood is out here in spongy bone rather than being in here. And the connections are the same. Because there's some words here that we haven't really talked about, I'm going to talk about them really quickly here. Can't remember if we talked about them with epithelial, when we talked about tissues or not. When a cell ends in blast, or when something ends in blast, it means it's a building cell. Bear with me just for a second here. Oh, not what I meant to do. So anytime a word ends in blast, and we'll see this again, we're going to see it several times. Anytime something ends in blast, means it's a building cell. Building or secreting cell. anytime it ends in clast, that means that it's a cell that's breaking things down. Breaking down a cell that breaks down things. Things. Anytime that it ends in site, in this case, it's referring to a cell that is kind of in a dormant stage, but not really, kind of a state of just maintaining. Not really building, it's not really breaking down. If necessary, especially with osteocytes, if necessary, it can go back to being a building cell or a cell that's breaking things down. Depending on what's needed at that moment. So this is a cell that's really maintaining things. Maintenance cell. It's there when it's needed, and it can be convert back into a building cell or a cell that's breaking down. But at that given moment, when it's an osteocyte, it's just being maintained. It's just maintaining. It's not the architect of the building. It's not building up the wood of the building. It's being the custodian and the repairman and just making sure that it's maintained. If needed, it can break it down or build it up. So osteoblast is a bone cell that's building or secreting bone. Osteoclast is a bone cell that's breaking down bone. Osteocyte is a maintenance bone cell. Do you see the connections? Nice thing about doing this right now is that when we see it again and we're in chapter 7, you guys will all be pros at it and you'll know exactly what we're talking about the whole time. So osteocytes, when we're talking about the spongy bone, they're residing on the surfaces of the endosteum. And osteoclasts are residing on the surfaces of the endosteum. If you look here, what does this tend to look like right here? Actually, let me see. Do I want to say that? Give me 1 second. Yeah. What does this is bone? What is this? What type of tissue does that look like?
Adipose?
You're right, it's adipose tissue. So this is yellow bone marrow. This is bone. And within this bone are osteocytes residing within their cavities, the lacunae. Do you see? The little cavity it's around, it's in. So comparisons of spongy versus cancellous or cortical bone. Okay, gonna shift gears here. I don't think we're gonna get into chapter 3 tonight. Again, but we'll finish it next week. The skeleton is divided into 2 parts. And you know what? It's been an hour and a half. And no, we haven't spent a lot of time lecturing, but let's stop just for 5 minutes and come back. So let's come back. My clock says 7:31. Let's come back at 7:36 and get up and move just for a second. You're stuck. How did you get stuck? There you are. Joe Barrington. Okay, so let's come back into this. So the skeleton is divided into two parts, the axial skeleton, which includes the skull, the vertebral column, and the thoracic cage. And that appendicular skeleton, or sometimes we call it the appendicular skeleton, meaning appendages, includes the shoulder and hip bones and those of the upper and lower extremities. So forelimbs, hind limbs, shoulder bones, and hip bones. Overview of the bones: the skull, the mandible, the clavicle, the scapula, the humerus, the radius, the ulna, the carpals and metacarpals and the phalanges, the ribs, the sternum, the vertebral column, sacrum, the femurs, the patella or your kneecap, the tibia and the fibula, the tarsals, analogous to your carpals, your wrist bones, but for your ankle, your metatarsals, and your phalanges. The skull is composed of cranial bones and facial bones. There's 8 cranial bones that make up the cranium that have direct contact with the brain. The parietal bone, the frontal bone, the ethmoid bone, the sphenoidal bone, temporal bone, occipital bone, and I know I'm missing some. Let's see here. The ethmoid bone and the inferior nasal meatus. No, I don't think that's right. Well, I'll see them again in a second here. You don't have to list them all off. 8 cranial bones that form the cranium. Actually, no, I think I did name them all, but the parietal bone, there's 2 of them. The temporal bone, there's 2 of them. That's the reason I'm missing some of them. I'm thinking, I know these. Facial bone includes 14 bones that form the face and have no brain contact. So looking at the front surface, and I'm going to zoom out just a little bit. The frontal bone, the nasal bone, the parietal bone, sphenoidal bone, which almost fits right below, right posterior to the nose, and is the basement of the cranium. The ethmoid bone, the temporal bone, the zygomatic bone, the maxilla, the mandible, within your inner ear, you have 3 small bones that all mammals have: the incus, the stapes, and the malleolus. Shh, 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 shh. Don't bark. the lacrimal bone, the palatine bone, and the occipital bone. On a side view or lateral view. The parietal bone, the occipital bone, the zygomatic bone, which is right here. The temporal bone is right here. Frontal bone, the maxilla and the mandible. So the 8 cranial bones include the ethmoid bone, 1 frontal bone, 1 occipital bone, 1 sphenoid bone. I like the sphenoid meaning like sphinx. It's going to rise again if you were ever a Harry Potter fan. The sphenoid bone, the sphinx. The parietal bones and the temporal bones. The frontal bone, parietal bone, occipital bone, frontal bone, ethmoid bone, sphenoidal bone or sphenoid bone, parietal bones, temporal bones, parietal bones, and the occipital bone. I'm just going to stop just for a second here. So the other model that I have, and I don't have a lot of models. Teaching online this semester, I learned that they would not lend me any models from Hack. So these are ones that I've purchased. But I still think they're a good idea to put things into context. So the frontal bone, the zygomatic bone, the temporal bone, parietal bone, occipital bone, on the inside. So this is where my face is, right up here. Frontal bone, ethmoid bone right here. The sphenoidal bone. Temporal bone. No, wait. Temporal bone, sphenoidal bone, parietal bone, occipital bone. So sutures, major cranial sutures. And I'm gonna stop sharing again just for a second. So here's my front. The one that's right on top here, comes right across here, is the frontal suture. You remember frontal sections, meaning it's going to separate the front from the back? My frontal section does the same thing, separates the front from the back. The sagittal suture, separating the two parietal bones. And if you think sagittal section, it's doing the same thing. If you were going to cut right down, it'd be a sagittal section. Very back here. I know you probably can't see it really well, but right here, coming up through here, and out through here is the lambdoidal suture. It looks like a lambda. Coming down like this and like this. Connecting the parietal bones to the occipital bone. And on the side, right here, is the squamous suture. Squamous meaning feather-like. This is actually a really, really, really thin suture. Your other sutures tend to be much more thick. This one actually has some give to it. It's very, very thin because squamous means feather-like. Any questions or comments? So the lambdoidal suture looks like a lambda. The squamosal suture or squamous suture. The coronal suture or the frontal suture. And the sagittal suture. The coronal or frontal suture. Remember, a coronal section is also separating the front from the back. Sagittal suture. The lambdoidal suture. In the baby skull, the bones are not fused. You don't have the full skull sutures. I always like when I'm holding a baby, I like to look for the anterior fontanelle or the soft spot on their skull. Fontanelle meaning little fountain. A lot of times I've never done it because I would be a little hesitant. but you can feel a pulse here on a lot of young babies. My mom has told me. I've never tried to feel a pulse there. So the coronal suture, squamosal suture, which has a sphenoidal fontanelle, lambdoidal, a mastoid fontanelle, and a posterior fontanelle. These little soft spots. I think this is the last one to fuse. If you've heard of craniosynostosis, what that means is that the baby is born, or they're either born or they fuse too early, the bones of this cranium. What they have to do is go in there and cut them apart. Any questions about bones of the cranium? For a moment. So the 14 facial bones include 2 maxilla. So where there's 2 maxilla, they come together and they fuse on the part front of the face. 2 nasal bones. 2 lacrimal bones, which are right adjacent to that nasal, right next to the, bear with me here. Right in between the maxilla and the nasal bone. Actually, bear with me. Nasal bone, maxilla, lacrimal bone. Lacrimal, if you think where your tear ducts are, lacrimal meaning to cry. So there's the lacrimal bone right there. Right behind it that you don't see on this picture is the ethmoid bone. Within the nasal cavity, there's 3 nasal concha. Concha meaning a circular, like shell-like shape. 2 of them are made from different bones, but the inferior nasal concha is a bone all of it on its own. It's a separate bone all on its own. So you have a superior nasal concha, a middle nasal concha, and an inferior nasal concha. The nasal concha is its own separate bone. Zygomatic bone makes up the majority of your cheekbone, with part of the temporal bone. Here's your temporal, actually, bear with me here. Going back further, your temporal bone would be back further. Let me show you actually on this guy. So looking right here. Here's your temporal bone. Here's where your ear would be. Here's your temporal bone. Here's where your ear would be. This is the zygomatic process of the temporal bone. This is the temporal process of the zygomatic bone. So part of your cheek is made of the zygomatic bone. Part of it is made of the temporal bone. The vomer bone is this little tiny odd bone. That's why it's called the vomer bone, is because it's just weird. This little vomer bone, this little bone that sticks up right in the center of the nasal cavity. So on this skull, it's this little bone right here, this little divot right here is the vomer bone. And then the mandible. Many bones have markings that serve as passageways for blood vessels and nerves, or attachment points for ligaments and tendons. I'm going to zoom in on this really quick. So a condyle of a bone is a large, smooth, rounded-like structure. A facet is a small, flat, shallow, like articulating surface. A head is a prominent rounded epiphysis. So this is only going to be found on the epiphyses of bones. A trochlea, which I'm trying to think if, I don't think there's more than one of them. The one that you have is on your elbow, right here of your, making it part of your part of your humerus. The alveolus are deep pits or sockets in the maxilla or the mandible. Fossa is a valley, a flattened or shallow depression. A sulcus is a narrow groove. A crest is a narrow, prominent ridge-like projection. An epicondyle, think of a condyle as being that rounded articular surface. An epicondyle is this bigger projection adjacent to a condyle. Remember, epi always means on top. So this is a bigger projection right next to a condyle. That's why it's called an epicondyle. A line is a low ridge. A process is any marked bony prominence. A ramus looks like the arm of, or rami, or angular extension of a bone. A spine is a pointed, slender process. Trochanter is a massive round projection found only on the femur. Sure, just for a second. So on Chester, AKA Bob, the trochanter is this area right here. There's, oh, don't fall, baby. Okay. There's a greater trochanter, and then there's a lesser trochanter. Greater trochanter, lesser trochanter. And these are only found on the femurs. Tubercle is a little small bump. Tuberosity is a large, rougher bump or projection. A canal, just like other canals, is a passageway through a bone. A fissure is a narrow slit-like opening through a bone. A foramen is a hole, and a sinus is a cavity. So looking at the front of the skull, looking at the front of the skull. Here's the frontal bone. Above the eye is the supraorbital foramen. Remember, foramen means hole. Supraorbital foramen right here and right here. Supra meaning because it's above, orbital the eye. So a supraorbital foramen is a hole above the eye. So there's a supraorbital foramen. And if there's a supraorbital foramen, there's probably an infraorbital foramen because we have to match things up with naming. There's an infraorbital foramen right here and right here. So supraorbital foramen, infraorbital foramen. Looking back into the eye cavity or the orbit, this bone right back here is part of the sphenoidal bone. And then the temporal bone, the ethmoid bone, the lacrimal bone, and the maxilla and the vomer. In the very back of the eye, this little notch right here is the optic canal, which is where the optic nerve is going to enter the eye. The superior orbital fissure, and always a good way to remember things is if you have a superior one or supra one, you have an infra one or an inferior one. So here's the superior orbital fissure. Here's the inferior orbital fissure. Let's see here. Here's the inferior nasal concha. The perpendicular plate, which is part of the ethmoid bone. Remember the ethmoid bone is this little purple one back here that also sticks up. Right here. This is where the front of the face would be. So the ethmoid bone right here includes this little part right here and this part right here, the perpendicular plate. Questions?
It's not really a question, but so my husband had fell one time and he actually fractured it. I guess it would be like it's like right on the side of his eye, kind of like where it kind of looks like this zygomatic bone, but like up where the zygomatic and the frontal bone kind of connect. He fractured right there.
Ouch.
It's just weird to think that that's still part of the cheekbone.
Oh, it is, and it's not. Is it considered part of the cheekbone? Is that what they told him?
No, they just said the way they explained it, I guess, so he would understand, was that he fractured his eye socket bone.
Yep.
Is pretty much what they told him in layman's term.
Yep. Yeah. Ouch. Wowzer. He's lucky he didn't does he still have good sight in that eye?
He does, but he has like a big scar that's like, and it's like really dark, like a blackish colored scar right there.
How long ago did he do it?
Oh, like 5-6 years ago.
Okay, wow. Ouch. Well, it's a good one to tell a story about. Ouch. I have a friend who was hit in the side of the face with a softball, and it broke this area right here. And ironically, and I was thinking I'd show you this one in lecture, but we're kind of getting ahead. I broke my mandible, and I broke it in 4 places. And I broke it along right here, right here, right here, and right here. And I'm not going to show you my x-ray tonight because we don't have time, but I will show you in lecture, or I'll show you at the beginning of lab next time, because being an anatomist, it wasn't that fun when I did it, but it's awesome now. And that it's a really good, it's a good picture. And I have a lot of metal in my mouth from doing that. But I've never broken up there. The alveolar processes of the maxilla and the alveolar processes of the mandible. The mental foramen. If you think about, you've seen the sculpture of the thinking man that goes, that's your mental foramen. So getting a more up close look at the orbit, the supraorbital notch, which a lot of times is also the foramen. It depends on whether it's a complete hole or not. I think on my skull, my fake skull here, it's a complete hole. But here's the infraorbital foramen. Here's the nasal bone. Here's the maxilla. Here's the lacrimal bone, the ethmoid bone, the frontal bone, the sphenoidal bone, zygomatic bone, maxilla. Looking at the side of the skull, remember the frontal bone, the parietal bone, the occipital bone, the temporal bone, the sphenoidal bone, the zygomatic bone, the maxilla, the mandible, the coronoid process of the mandible, the mandibular condyle, mandibular process and mandibular condyle. Actually, no, mandibular fossa would be right here, mandibular condyle right here, which fits into the mandibular fossa. The external acoustic meatus, this is all part of the sphenoid, the temporal bone. The external acoustic meatus, which is your ear canal. Acoustic meaning sounds, meatus meaning large canal. If you have an external one, you have an internal one. So on the interior of the skull, you can see an internal acoustic meatus. The mastoid process, mastoid meaning a breast. You know, these were named by guys when we named something after a breast. But that wasn't very nice. I'll keep that language to myself. But right here, mastoid process, you can feel it on the back of your, right behind your ear. So looking at the internal structure, here's the frontal bone, parietal bone, temporal bone, the sphenoidal bone, which has a sphenoidal sinus in it. The vomer, the maxilla, the mandible. On the very back of your mandible, on the internal posterior edge of the mandible, you have the mandibular foramen, which is where the nerves actually enter your mandible. And those are the nerves that they often will anesthetize when they are doing dental work on your mouth. Styloid process. You can't see it really well on there, but you can see it really well on this skull. So if you look right here, you see that little tip that looks like it could actually be more like a pen? You've seen styluses. So this is a styloid process of the temporal bone. It looks like a stylus. It looks like a writing instrument. And here's the mastoid process. Actually, we'll show you some other stuff here. The coronoid process of the mandible. The mandibular process that sits in the mandibular condyle of the temporal bone. This little area right here, this is the TMJ, or the temporal mandibular joint. You've heard of people who struggle with TMJ. That's what they're struggling with. Let's see here. I know this one comes off, just a sec. There. So looking on the internal surface of the mandible here, you see the little tiny hole? That's the mandibular foramen. The mental foramen, and the alveolar processes of the mandible. So I told you there, you saw the external acoustic meatus. Here's the internal acoustic meatus. So it's part of the temporal bone. The hyoid bone is a floating bone. It's the only bone that doesn't articulate with other bones. It's the bone most easily broken upon strangulation. I know you really wanted to know that, but it's that one. I told you I like violent walks.
I learned that in a TV show called Bones.
I know. I like that show too. I kind of have gotten out of it because it doesn't seem to be going in a way that I like it to be going. But I learned that in that show too.
So what purpose does that bone even serve?
It's a place where a lot of muscles insert and originate. And I'm trying to remember what other functions it serves, and I can't remember right off the top of my head. We'll look it up, but I don't have time today. I'll look it up and I'll tell you if I can think of something. I don't think you can be born without it because a lot of your muscles of your neck and your jaw are either originating there or inserting there.
So you can't feel that? You can't feel it?
I think it's fairly deep.
Oh, okay. Huh.
No, you can't feel it yourself, but if your provider, like a nurse or a provider, can feel it if they press really hard on it, on your neck, depending on where they're pressing.
I'm realizing that my Bob doesn't have one. I don't think my other skeleton has one. Darn it, I don't have one on either one of them. So the ethmoid bone has a crista galli. You saw it looked kind of like a tap. On the internal surface here, Christogali looks like a little tip. Christa meaning chicken, Golly meaning the comb. Actually, no, or reverse that. It's Christa meaning comb, Golly meaning chicken. So this is the comb of a chicken. It looks like this. The sphenoid bone. Oh, the cribriform plate. Let's back up. Cribriform plate. Cribriform means like a sieve or a filter. Cribriform has a bunch of little tiny holes in it. This is all part of the ethmoid bone. Has a bunch of little tiny holes in it where the olfactory nerve is going to enter into the nasal cavity to allow you to smell. The sphenoidal bone. The foramen rotundum, the sella turcica, which is right here, which includes that hypophyseal fossa. Foramen, let's see here. Foramen lacerum. It's foramen lacerum. Right here. Foramen ovale and foramen spinosum. Foramen lacerum. Sella turcica, which is this little area right here, means Turkish saddle. The easiest way for me to remember these little holes right here is Turkish saddle means that there could possibly be a little cowboy who could sit there. This is a mnemonic, okay? There's a little cowboy who sits right here in this Turkish saddle. It looks better in my skull. If you look right here, here's the Turkish saddle. It looks like a little, right here, looks like a little saddle. So there's a little cowboy who sits there. And he sits and he's straddled on both sides of the saddle, just like you would if you're riding a horse. And he looks out through the optic foramen, which is right about right here, the optic canal, which is right out through the optic canal right here. He puts his boots into foramen rotundum on both sides here. So remember, there's a cowboy right here. So he looks out through the optic canal, which isn't labeled here, but it's right here. Puts his boots into foramen rotundum. Puts his lasso into foramen lacerum. Right here. He spits over foramen ovale into foramen spinosum. That is the easiest way that I know of to remember all those holes. And I can tell you that while I was describing that to you a second ago and tell you initially where they were, I was going through that mnemonic. So there's a cowboy sitting right here. He looks out through the optic canals, puts his boots into foramen rotundum, puts his lasso into foramen lacerum, because you always put the lasso behind you if you're a cowboy, as far as I know. Put your lasso into foramen lacerum. You spit over foramen ovale into foramen spinosum. There's a really big hole right here for Raymond Magnum. Magnum meaning big, foramen meaning hole. So this is a really, really big hole. If I'm looking at my skull, it's this one right here. Really, really big hole. Jugular foramen is where the jugular vein is going to drain down. Carotid canal is where the internal carotid artery is going to come up into the brain. Sinuses in the skull. You have frontal sinuses in the frontal bone. Ethmoid sinuses in the ethmoid bone. Sphenoidal sinuses in the sphenoid bone. And maxillary sinuses in the maxilla.
I have a question.
Okay, be quick about it. We're running out of time.
Are adenoids considered muscle or are they considered bones?
Adenoids are considered part of the lymph tissue. They're not muscle and they're not bone. They're reticular tissue. They're like your spleen or your lymph nodes or your tonsils.
Oh, okay.
Good question. So this is a sphenoid bone. Remember how I told you it looks like a sphinx? Or think of it as being a sphinx? I don't know if I shared this. So I have a good friend and we haven't talked in a while, but she lives in Arizona now. She moved from Idaho about the same time I moved. She moved from Idaho to Arizona about the same time that I moved from Idaho to Maryland. And so about 3 years ago, yeah, approximately. And she described the sphenoid bone to me as a bird on crack. And it really works because if you look at this bone, here's the wings, here's the head, here's the lesser wings. It's got 2 sets of wings, 2 sets of feet, the greater wings and the lesser wings. And the foramen rotundum, where that little cowboy is going to fit his little lasso, his boots in, is right here. Foramen ovale is part of the sphenoidal bone. But yes, it looks like a bird on crack. If you look at it for a minute, it's pretty close. Inferior view. So jugular foramen, carotid canal. So jugular foramen, carotid canal, foramen ovale, here's your palatine bone. So the not the palatine bone, the palatal process of the maxilla, and the palatine bones are back here. We're looking at right here is looking up this way at the sphenoidal bone. So these 2 little processes right here, these pterygoid processes that make up the feet of this bird on crack, are right here. You're looking up this way at this structure, at this bone. the carotid canal, the foramen lacerum, styloid process. The mastoid process is right there. Here's the styloid process of, remember that looks like a little sharp point? Mastoid process right behind it. And the foramen magnum. Questions? There's your mandible. Condylar process, which fits into the mandibular fossa. Looking at the rib cage, the sternum, the jugular notch, the clavicular notch. There's 3 notches on the sternum, or the manubrium, which is the top part of the sternum. There's 2 clavicular notches because this is where the clavicle is going to articulate with the sternum. The clavicular notch where the clavicle articulates. The jugular notch, the manubrium, the body, and the xiphoid process. Manubrium, they actually, the way it looks is you think of the sternum as looking like a sword. Here's the handle of the sword, the manubrium. Here's the body of the sword. Here's the sharp point of the sword, the xiphoid process. Of the rib cage, there are 7 true ribs and 3 false ribs and 2 floating ribs. True ribs means that they articulate with the back of the vertebral column, come all the way around to the front, and articulate via their own costal cartilage with the sternum. That means that they're a true rib. When they articulate with the back of the vertebral column, come all the way around and articulate via their own costal cartilage on the sternum. The false ribs are not true ribs because they may articulate with the vertebral column, but they have to merge with the cartilage of with cartilage number 7, the costal cartilage of number 7, in order to articulate with the sternum. That's why they're the false ribs. So 7 true ribs, 3 false ribs. And there's 2 floating ribs because they articulate with the vertebrae, but they don't articulate with the sternum. Questions? So looking at a typical rib, the neck, bear with me just for a second here, I gotta make sure. Yeah. The neck or the head is going to articulate with the vertebrae. So Yeah, I'm pretty sure that's the way it is. So the head is going to articulate with the vertebrae. This tubercle's in the back. And then you have the angle in the costal groove, which is, and this is going to articulate with the sternum. So the head, the neck, the rib tubercle, the body, the angle, and the costal groove. Very last part here. Cervical, thoracic, and lumbar vertebrae. Typically, what time do you tend to eat breakfast? Somebody tell me. Be quick. Tell me a time that you tend to eat breakfast.
When you're
6 a.m.
Whoa.
How about we go with 7 a.m.? Let's say 7 a.m., okay? Therefore, there are 7 cervical vertebrae. What if you eat breakfast at 7? When do you tend to eat lunch? Let's go with noon. So there's 12 thoracic vertebrae. If you eat lunch at noon, when do you tend to eat dinner? At 5. You have 5 lumbar vertebrae. So 7 cervical vertebrae, 12 thoracic vertebrae, 5 lumbar vertebrae. And I just shared two little process, some little tiny things about the vertebrae, and then we'll be done for tonight. Cervical vertebrae, every one of them has a body. That's the anterior part of the vertebrae. And a spinous process, which is what you feel with regards to the thoracic vertebrae when you look at the little spines of someone's spine up the back, up their back. Transverse processes. The spinous process on the cervical vertebrae is bifurcated. It's got a little split in it. It also has a transverse foramen. The way that you can tell the difference between a thoracic vertebrae and a lumbar vertebrae is the thoracic vertebrae, at least in this case, has 3 notches. 1, 2, 3. On a lumbar vertebrae, it has 7. 1, 2, 3. Excuse me. 1, 2, 3, 4, 5, 6, 7. You don't see it on this one, but this one actually has 2 coming down also. So it typically thoracic vertebrae have 5, lumbar vertebrae have 7. That's the way you can tell the difference really easily between a thoracic vertebrae and a lumbar vertebrae. The vertebral foramen, meaning where the spinal cord's going to enter, is right here on all of them. Do you guys have any questions for me?
I do, but it's not related to the class, and it can wait until everyone else is done.
Okay. The one thing about the difference between the C1 and the C2, and I think I'm going to cover some of this. I may, shoot. No, I'm not gonna do that. Never mind. C1 is the first cervical vertebrae. They go C1, C2, C3, C4, C5, C6, C7. Cervical 1 through 7. T1, T1, 2, 3, 4, 5, 6, 7, all the way down to the thoracic. 12, T12. Lumbar, L1, L2, L3, L4, L5. By far, probably the easiest to remember. Because if you just count down, you know what you're looking at. There's a unique connection between C1 and C2. Because C2 has what's called a dens that protrudes through the top or the internal surface of C1. What does dens mean? You know what a dentist is. What's dens mean? What's a dentist?
The teeth doctor, isn't it?
The tooth doctor, right. So a dens is a tooth process. Sticks out right here on C2. And it allows it to articulate and allow you to do this with your head. When they cervically dislocate mice during lab experiments, this is what they break. I know you really wanted to hear that. You won't forget it now. Because Sherry's like, oh, Mary, did you really have to share that one? As I told you, I like to listen to violin books. This is how they break people's necks too, because they do the same thing. My mother says, Mary, did you really need to share that one? Scoliosis, meaning a curve to the side. Kyphosis, meaning an upward curve towards the top. Lordosis, curve towards the bottom. And you guys, that is the end of the axial skeleton. Sorry, we went a few minutes over. Questions? Okay. Let me know how it goes with the Wiley. Work really hard. When I put these PowerPoints together, I try to make sure that everything that I'm asking you to find on Wiley are on these pictures. So let me know how it goes, and I will see you next Monday. And remember that exam is open to you. Do it if you want to right now. Do an attempt now, and then do an attempt later if you want. If you want, I'll give you 3 attempts and you can do it again. I don't care. Do you want me to give you 3 attempts?
Sure.
All right. Okay.
Not a horrible idea.
I mean, it gives you a random pool, but yeah, here, just a sec. Before anybody starts it, it won't let me do it after somebody starts it and submits it. Unless I do it for everyone individually, which takes some time.
Thank you, Professor. Have a good week.
Yeah.
Everyone.
Give me 1 second. I'm sorry, bear with me. Okay, nobody started it. Good. Let me just edit it really quick.
So who's do you know the name of the dean that handles the science division?
Why?
Huh? I wanted to know, I was gonna email
Before I
him to,
start giving out his name and he comes back and asks me why why I did what I did, why?
well, I wanted to ask him about the lab for AMP2 to see if maybe he would know.
He may not be able to tell you because he's in one campus. He can't probably tell you what every room is like everywhere. Does that make sense?
Yeah.
That's why I'm saying find out where do you think you're gonna take it face to face?
It looks like I was looking at the course list for fall and the summer, and it looks like it's all in person.
Why are you taking it during the summer?
Because I can't take it in the spring. I'm taking AMP1 in the spring, so I want to take it right after I'm done with this class.
Don't take it in the summer. Take it next fall.
Is it a lot of information all at
It
once?
is. It is. As Zena, who's taking it right now. Zena?
Yeah, it really is.
Is it more than this class or is it about the same?
No, I think it's more than this class to me, but also it depends on the professor that you'll be taking it with too.